Hi, welcome to the Fit and Healthy Today show, and today our topic matter is osteoarthritis. I divided up osteo and rheumatoid because there are two different classifications of arthritis. The causes are different, things are different about them. So today we're going to just address osteoarthritis, defined as the local or generalized degeneration of the articular cartilage and the formation of bone spurs at the edge of the joints. So literally you'll get these little calcium deposits or spurring on the edge of the joints. The cartilage will thin and deteriorate, and then eventually, if allowed to go on further, you can end up with like a bone-on-bone situation, and that's called basically total cartilage deterioration. Symptoms are generally gradual with osteoarthritis, and they're progressive pain, more and more pain. You get a little bit more stiff. You get up in the morning, you're like, wherever it's appearing in the hip, the shoulders, the elbows. And then it can involve one or multiple different areas, but it never moves. With rheumatoid arthritis, it can move because obviously it's caused by different factors. The causes when we're talking about osteoarthritis are many, but a lot of them have to do with poor diet, and nutrition, and the lack of ability to break down certain types of foods. When you're eating nothing but junk food, it sits in the bowel and it rots. You're not giving your body any nutrient-rich foods, no multiple vitamins, no vitamin C's, then eventually, with all these multivitamin and mineral imbalances, or vitamin and mineral imbalances, you're going to end up with the lack of raw goods in order to build good cartilage. So you got to kind of have raw materials in order to build that cartilage. So number one, you got to have the raw materials. If you're lacking the raw materials, your cartilage tissue will disintegrate and osteoarthritis will occur. Chemical imbalances. Now I mentioned the fast food diets. When we look at the chemical imbalances, we got to look at the reasons why. I'm a scientist, and so I kind of look at the reasons why things are. Excessive meat and soda. You end up with a high phosphorus to calcium ratio, and that basically doesn't allow for the cartilage to rebuild, and it causes those calcium deposits to occur and that spurring to occur on the end of the joints. Meat, for example, can have a 20-to-1 ratio of phosphorus, red meat. A 20 to 1 ratio of phosphorus to calcium, which in turn, literally, those heavy meat eaters, their chances and odds of having osteoarthritis are very, very high. Lots of studies that basically state, and here's some defense of the vegetarian diet again, and I'm not talking about the pasta vegetarian diet, I'm talking about vegetarian with beans and vegetables, that type of thing. Definitely shows that vegetarians as a general rule have a lot less osteoarthritis. When we're looking at coffee, refined carbohydrates, those are very acidic producing foods, and when you're acid, the body will pull calcium out of the bones in order to neutralize the acids, and those little bone spurs will form, and the acidity breaks away not just your bones, but your cartilage tissue as well. It damages the vascular feeds. So you got little capillaries and blood vessels that feed these joints, and when those disintegrate, there's no ability to get nutrients in the joints, and then they in turn disintegrate. Hormone imbalances. Now that can be testosterone for men, estrogen and natural estrogens produced by the body, and progesterone for women. When you have those hormonal imbalances, the body oftentimes will not make new bone, or the lack of certain types of hormones will cause a disintegration of the bone. In addition, certain thyroid or parathyroid, that means when you have excessive calcium versus magnesium ratios, parathyroid will also lend itself to osteoarthritis. Food allergies and sensitivities, particularly like to gluten or individual allergies to particular foods, allow you to stay chronically inflamed. And that means your joints are going to be inflamed, the connective tissue around the joints are going to be inflamed. And that being the case, it's very, very important to not eat foods that you know you're allergic to. And then if you suspect that foods could potentially be an issue, or you know that your mom is allergic to milk and to gluten, then you better get checked to find out whether or not you have those food intolerances or allergies. Excessive wear and tear, injury, absolutely. If you injure an area, and for example, let's say that you dislocate an ankle, and everybody pops it in, and you don't have the adequate amounts of calcium, magnesium, vitamin C, the raw materials for that to repair, you will form scar tissue and end up with chronic problems in that ankle or that knee or whatever else in that regard. So that scar tissue building, those blood vessels being damaged, not giving you the right feed, and you'll end up oftentimes like a lot of the high school football players will see in their 30s, they've got osteoarthritis because of injuries and the lack of care that was given to the injury post-trauma. Biomechanical imbalances. We learned awful lot from the Olympics. And we kind of learned, they have all these fancy machines that test people on how they run, whether they're up, they're down, they're out, all that. And whether or not they're balanced or not in their structures, be it skeletal or muscular structures. And so what can happen is because, for example, people that sit all day long, they develop certain patterns in their muscular tissue that when they stand up, they have a much greater propensity over a period of time because of the way their structure is and they're stooped, is they have a much higher propensity for having hip arthritis. Obviously we've got the tennis players from all different actions and movements and motions, which is a continual movement or motion, can contribute to arthritis in the elbows, shoulders. We've got a lot of construction workers that'll see those. But once again, when you have biomechanically one muscle stronger than the other, or one side stronger than the other, then that can tend to make you off balance and lend itself to having biomechanical problems, which can contribute to osteoarthritis. I know a lot of physicians and a lot of people out there poo-poo chiropractors, but I have to tell you, getting those alignments and recognizing that those alignment issues are a problem are vital for prevention as well as care once you think that you have osteoarthritis. Now, something that I didn't write down on here also too is the lack of exercise. If you exercise, you get blood into the tissues. You have a balance of the muscles, particularly with strength training, where you have an equal balance and you're lifting equal weight. You can keep the muscles in a balanced fashion as well, or in cases like yoga or Pilates. Those people who participate in exercise, and they've done tons of exercise in seniors who had a lot of pain, and found when they addressed exercise back into the regimen or got them set up on an exercise regimen, their pain reduced significantly, up to 84%. So very important. Course medications such as NSAIDs, aspirin being one of them, which can cause cartilage deterioration. I'm horrified by a lot of physicians' recommendations for an aspirin a day on patients that are low risk, that have not had a previous heart attack or any of those issues, because it eats away connective tissue, including heart lining and cartilage tissue. Cortisone, well, over a period of time, you just won't have anything left. So once again, responsible use of cortisone is necessary when you have injuries. Okay, we touched upon the diet. No red meat or pork. Eat chicken only occasionally. You want to go with plant-based proteins. Lots of alkali-producing vegetables and fruits. Garlic, onions are very rich in sulfur compounds. Kale, celery, they're alkali-producing. They lower the acidity rate. When you keep your body more an alkali base, you're going to have less deterioration on your joints. The more acid you are, just like anything else, you pour an acid, you pour soda on meat or that type of thing, it'll eat it away. That's exactly what will happen with an acid diet. So that being the case also, you're going to avoid all citrus when you have arthritis, fried foods, most dairy products, wheat, alcohol, salt, and particularly nightshade vegetables, which are your tomatoes, potatoes, eggplant, and peppers. Rutgers University studies, I think this was done in the 1980s, basically said that 78% of Americans are nightshade sensitive. So if you have any inflammatory issues, you do not eat nightshade vegetables because they won't allow you to deflame. They don't cause inflammation, but they don't let you to deflame. The last segment here, I'd like to talk about the supplements. And every one of these I have on here has double-blind placebo studies, and I have various physicians, doctors, naturopaths, and chiropractors that recommend these. Glucosamine sulfate, a better form in acetylglucosamine because it does not affect your blood sugars, is needed for the formation of bones, tissues, cartilage, and tendons. And you can buy the product and utilize it if you suspect you have any of those, not just osteoarthritis, but any of those issues and the inability for those tendons, ligaments, or joints to repair. Naturally derived hyaluronic acid, and I'm not talking something that comes from your local warehouse store that is from China. We're talking about a good naturally derived. It increases the proliferation of chondrocytes in the collagen and joints, whereas chondroitin sulfate, and oftentimes I know we have Dr. Lindbergh recommends the combination of these two together. Chondroitin sulfate increases the synthesis of the chondrocytes in the collagen. So therefore, when you do that, that reduces pain and inflammation. This is a wonderful combination to take. It takes about 4 to 6 weeks, so you have to be a little patient, but it definitely does help the cartilage tissue soften and gradually rebuild. MSM, it's a sulfur compound. You know how I mentioned utilization of onions and garlic rich in sulfur compounds? Well, MSM we use for tendonitis, arthritis, all the connected tissues that are around these joints, because they don't sit alone. You got tendons and ligaments and blood vessels and cartilage and bone. They all make up your joint. So MSM can be very supportive in reducing inflammation, and once again, it's an integral part or component of cartilage. So wonderful combination of these three together. Now, multivitamin high in B vitamins. You know how an ounce of prevention is worth a pound of cure? Well, taking a multivitamin high in B vitamins, along with keeping your vitamin C levels high, protects the joints and the vascular feed and helps that tissue repair. If you don't have adequate amount of vitamin C, which increases your natural cortisone production, it's going to be very difficult for you to reduce inflammation in the joints. And without C, you can end up with a lot of cartilage, or a lot of what are called scar tissue fissions. You'll get muscle tissue or tendon ligament tissue that has these scar tissues on it, and then the bone spurs form around it, and it kind of cuts around it. Very painful and very difficult for any physical therapy to help much with that. When you do have bone spurs, I recommend a combination of calcium hydroxyapatite or citrate along with magnesium citrate in a 1-to-1 ratio along with B12. Now, I know most people don't think in terms of B12 with preventing bone spurs or dissolving bone spurs, but this combination, and I use this as a professional trainer for a lot of years, particularly the calcium hydroxyapatite and citrate, to dissolve those bone spurs that collect because of all the acidic diet, junk food, and acid-forming foods. Fish oil. I wrote the dosages down that your fish oil should have. It needs to be a contaminant-free fish oil, once again, not from your local warehouse. It reduces inflammation and increases lubrication. It's kind of like oil to the Tin Man. Niacinamide, 200 to 400 milligrams of niacinamide over 2 to 4 times a day, increased joint mobility by 85% in 4 weeks. From an anti-inflammatory standpoint, I wrote 3 excellent ones here. Bromelain, turmeric extract, and ginger root. They're all great anti-inflammatories. Bromelain helps eat scar tissue, so you can take that immediately following an injury, and that can eat away some of the scar tissue. A lot of the plastic surgeons utilize it to eat scar tissue post-op. SAMe has some research, in addition to being great for your serotonin levels, has issues with reduction of arthritis pain. Dimethylglycine, we think of it in terms usually with autism use, but it can actually prevent arthritis and also some other brain issues as well too. Enzymes, oftentimes such poor quality food is being eaten that over a period of time, our ability to digest and break down our food is non-existent. Therefore, adding in some enzymes to help break down more nutritious food is recommended. Now, a lot of people say that cartilage is not repairable or replaceable, or I should say it's not replaceable, but it is repairable. And with time, proper supplementation, good diet, nutrition, and in the next segment I'm going to talk about some exercises that you can do to help balance, in particular in the hip area. If you keep the muscle tissues balanced in combination with proper diet and supplementation, we can prevent and reverse the damage. Anyway, let's move on next, and I'll show you that exercise in the fitness portion of our show. Thank you. Hi, welcome to the fitness portion of our show, and today I'm going to show you a good hip flexor stretch that could help you have perhaps a little bit more balance and pull some of those muscle tissues back into balance to help support the hip joints. First of all, you get in a position where you have a chair that's about the same height as your hips, and you get in an angle, a 90-degree angle, where your feet, ankles, and hips are all in alignment. You are going to feel a nice stretch. You keep your back perfectly straight, put your heads between your arms, and you're going to hold that for as long as you can. Keep the knees just a little bit loose, and you should feel a slight pull on the back of your buttocks as well as your hamstrings. Hold that for 30 to 60 seconds, and if you can do that a few times a day, you can relax. If you could do that 3 times a week, 3 times a day, so 3 days, 3 times a day, I think you'll notice a little bit more ease on the hip flexors and maybe a little bit more balance. Next, we're going to be moving on to the research portion of our show. Thank you. Welcome to the research portion of our show, and with us today is Ralph Turchiano. Ralph?
And to start with our first science trivia question, what specific type of beer has now become a marathon runner's or triathlete's favorite new tool? I'll answer that at the end of the segment. Now first, a little good news for old men, especially potentially dirty old men. Guess what? Well, the 93rd annual meeting of the Endocrine Society just released that old testosterone levels, do not decrease with age. And they said, quote, a decline in testosterone levels as men grow older is likely the result, not the cause of deteriorating general health. Meaning, all because you've taken 60 or 70 trips around the sun, that's no reason for your testosterone levels to decline. Now, for 60 or 70 years, been eating nothing but Twinkies and ding-dongs, that's more likely a reason for your testosterone levels to decline, not your age specifically. They also said the team, Handelsman and the team, found that serum blood testosterone levels had not declined with increasing age in older men who reported being in excellent health with no symptoms to complain of. We had originally expected, like most of us, like you see those TV commercials about the new drugs, about low T, well, maybe other reasons for having the feeling of low T. Where they originally expected that serum testosterone levels were going to go down with age, but they said their findings were a bit of a surprise. They took 2 centers in Australia, recruited 325 men over the age of 40 and between also in the average age of 60, who had self-reported excellent health and no symptoms of complaint. They then took blood tests 9 times over 3 months, and they discovered that age had no effect on testosterone levels. So, if your testosterone levels are going down, start looking at other things, not your age. Outside of that, well, disturbingly so, one of our major organic food markets, according to the UPI, they specifically pointed out Whole Foods market can no longer guarantee that their organic foods are not genetically modified. Yes, I said, organic foods, no way to determine if it's not genetically modified. The definition for most of us is if it's genetically modified, it's not organic. Well, not necessarily to the FDA and some major general organic food chains. They said, quote unquote from the UPI, because I don't want to get in trouble, genetically modified foods have become so common that even organic retailer Whole Foods says it cannot avoid having them in their stores. Organic foods, by definition, can't knowingly contain genetically modified organisms. But since basically that 93% of all your soy is now GMO, 86% of all your corn, 93% of all your canola, seeds planted in the United States, and basically 70% of all processed food in the U.S. is now genetically modified, the Whole Foods says they can't control it. Until there's a federal government mandated labeling of GMO ingredients, which ironically, most of the world does, but for some unusual reason, does not do it here, there is no way to determine if your organic food that you have is genetically modified or not. Interesting that we're so accepting of GMO that we could actually begin to slip it in there as potentially as organic. Stick with your small organic markets, ones that know the farmers, ones that can tell you where the food is coming from is genetically modified or not. I would start veering away from the large mass market consumer organic food markets that can't bother to even check to see if their foods are genetically modified any longer. All right, now to E. coli. E. coli is made in the news quite a bit, but there's a few tools, ironically, out there which are very effective against E. coli. One from the University of Southampton, this came out just a little while ago. They discovered that copper kills basically all E. coli. They said on a dry copper surface, the study shows that 10 million E. coli bacteria are eliminated within 10 minutes. On a wet copper surface, basically E. coli is eliminated within 45 minutes. They say copper continuously kills any pathogens that settle on it, reducing the risk of cross-contamination and help to prevent the spread of infection. That's simple copper. So a lot of hospitals may be moving more towards copper surgical equipment or copper in bandages or copper basically anywhere else, is syringes and you name it, because it's so incredibly antibacterial it even kills the toughest strains of E. coli. Interesting thing to think about too is to find out if people that are susceptible to E. coli also have the lowest levels of copper in their blood, something that they may want to look into in the future. Now here's another one on E. coli, one that I find a little disturbing. Supposedly they decided to reprint this article because in the Journal of Natural Medicine in the year 2000, they had a probiotic which supposedly killed E. coli and prevented the damage from having any effect. I'm talking damaging E. coli 104. They said a potential life-saving treatment for severe E. coli food poisoning outbreaks developed more than a decade ago has not gone forward into clinical trials because of lack of commercial interest. I.e., lack of commercial interest is we don't care about your life if there's no money involved in it, whether it be the U.S. government or private enterprise. The Adelaide research produced what they call the designer probiotic bacterium, which binds and neutralizes the toxin produced by E. coli, which causes a life-threatening attack on the kidneys and the blood vessels. They showed that mice infected with the highly virulent strain of E. coli were completely protected by the probiotic bacterium. The probiotic bacterium, on top of that, can be produced cheaply and on a large scale. There's your problem. It's inexpensive. It's obtainable for anybody financially to get into their system's hands, and therefore there's very little profit involved in it. So when it comes down to basically profiting your life, let it be known that even though they have an answer to these E. coli breakouts and saving people's lives, they'd rather have people sit in a hospital and rot than basically use a tool which has been available for almost 11 years now that can protect people from E. coli. They said, and the researchers said, this would undoubtedly have saved lives as well as millions of dollars in current health and in future health care costs. It says antibiotics are not used because they can increase the amount of toxins released in the gut. So something to think about. The answer's out there, just no money in it. And now for building muscle. Interesting enough, apples have been coming up over and over and over again in the news. Well, this finding was reported in the June issue of Cell Metabolism, a Cell Press publication. And this is what they discovered. They discovered a substance called ursolic acid, a waxy substance found in the apple peel, reduced muscle wasting and promoted muscle growth, albeit in mice to start, also reduced body fat, blood sugar levels, cholesterol, and triglycerides. Remember, it wasn't too long ago we had the thing an apple a day reduced the LDL cholesterol by 27%? Well, what they did was this. They were trying to find any chemical out there that could stop muscle from wasting. So they looked at 1,300 bioactive molecules, and they led them to just one, ursolic acid, that's found basically in the peels of apples that counteracted muscle atrophy. It says ursolic acid is an interesting natural compound, the scientists said. It's part of a normal diet as a component of apple peels. They always said an apple a day keeps the doctor away. Well, the experiment showed that ursolic acid could protect against muscle weakening, as predicted. Not only that, when ursolic acid was added to the food of normal mice for a period of weeks, their muscles grew. Not only prevented the atrophy, but also the muscles grew. Real interesting. They said it enhanced the insulin signaling pathways in the muscles and to corrections in gene signatures linked to atrophy itself. Animals given ursolic acid also became leaner and had lower blood glucose levels, cholesterol, and triglyceride levels. And they said, quote, this is from a scientist, "We know if you eat a balanced diet like mom told us to eat, you get this material," the doctor said, Adams said. "People who eat junk food don't get this." So something to think about. Apple, pancake, you decide. You're out, you can pick your own. All right, now for the more disturbing news. Patients that have advanced cancers often get treatments that basically don't work. What they discovered in by June 7, 2011, that 1 in 8 cancer patients basically get treatments that have absolutely zero benefit at a cost of an average of $2 million. I want to wrap it up a little fast there because main reason being I want to first answer the trivia question. All right, what substance is now a marathon runner's best friend, a triathlete's best friend? What beer? In Germany, it's called Weissbier, a wheat beer. Now, keep in mind they drank 1.5 liters of it, but it was non-alcoholic. I'll repeat, non-alcoholic wheat beer is what they drank. They discovered it lowered inflammation by 20% over a placebo group, and they were 3 times less prone to infection. Thank you.
Thanks, Ralph. Appreciate it. Once again, do your research, find the information for yourself, and you can look these types of articles up and find additional information for yourself. Thank you very much.